And all over the St. Louis Metro, intensive care units are filling up. Today I caught up with the clinical director of critical care medicine for Mercy Clinics to find out what's real, what's not, what's fact, what's fiction, and what's happening in the ICUs. He's been working with Mercy, and he also talks about the vaccine and why even vaccinated people right now can't let their guard down.
A little more than a month ago, the number of patients with COVID that were in all of Mercy's hospitals was less than 100. And now we're over 500, with over 200 of them in the intensive care unit.
Dr. David Tannehill, clinical director of critical care medicine Mercy Clinic and DO, says patients are getting really sick really fast. And the only real way to keep people out of the ICU and off ventilators is to get vaccinated.
The whole time that I've worked at this hospital, I've taken care of more people on ventilators the last few days per day than I ever have. It's very clear from looking at the literature and all the different studies, and then in my own experience and talking to my colleagues and looking at the numbers across all of Mercy, the difference between vaccinated and unvaccinated is huge.
Patients on ventilators are not dying at a rate equal to previous surges. However, Dr. Tannehill says it's too early to compare. He says most patients are in their 40s and 50s. He does believe if more people got vaccinated, there would be fewer hospitalizations and the community viral replication would be much lower.
The experts in the field, the people that study this, the people that know the topic are very clear, and it's been very consistent in what they've been publishing, that masking helps, social distancing helps, and above all, vaccination helps.
And as much as Dr. Tannehill is begging people to get vaccinated if they haven't already, he does say this.
This is a very important point to understand. Just because you've been vaccinated doesn't mean the virus won't get into your body. The virus can still get into your body, and you can still spread the virus, but you won't get sick.
Dr. Tannehill also tells me that he has not treated one patient in the ICU who's been vaccinated. All of his patients are unvaccinated. He also says with as many people who have been vaccinated, if there were a very serious problem with the vaccine, he believes he would have seen it by now in his ICU. And he also takes care of those patients, and he said that he would have seen a situation if there was a vaccine problem at this point in time.